Anger and stress are crucial concepts in dance and movement therapy or DMT. This approach operates on the understanding that emotions are not just mental experiences, they are also embodied in our muscular tension, posture, breathing patterns, movement habits, and nervous system responses. Anger is a normal human emotion, ranging from mild irritation to intense rage. However, when poorly regulated, it can disrupt our psychological and physiological well being. During episodes of anger, the autonomic nervous system activates the fight or flight response, leading to increased heart rate, elevated blood pressure, rapid breathing, muscular tension, and heightened levels of stress hormones like adrenaline and noradrenaline. Psychologically, anger is often a secondary emotion, masking deeper feelings such as fear, helplessness, shame, rejection, emotional hurt, frustration, unmet needs, or unresolved trauma. This understanding is vital for therapeutic work, which should address not only the visible anger but also the underlying emotional factors that contribute to it. Anger can stem from immediate external triggers like interpersonal conflict or perceived injustice, as well as internal triggers such as unresolved childhood experiences or stress overload. Individuals typically manage anger through expression, suppression, or regulation. Healthy expression involves assertive communication, acknowledging emotions without aggression. Suppression pushes emotions inward, which may reduce outward reactions, but can lead to passive aggressive behavior, psychosomatic tension, anxiety, or emotional numbness over time. Emotional regulation is the healthiest approach, involving awareness, impulse control, cognitive restructuring, relaxation, and self regulation. Common anger management techniques include trigger awareness, thought interruption, breath regulation, progressive relaxation, grounding, journaling, physical movement, mindfulness, cognitive reframing, and therapeutic intervention. In movement based therapeutic settings, physical expression is particularly important as anger often manifests as trapped energy in the body that requires safe discharge and transformation. Stress is defined as a state of strain that arises when demands exceed perceived coping capacity. It is both a psychological and somatic phenomenon affecting cognition, mood, immunity, sleep, and overall emotional regulation. Stress can be acute, enhancing performance temporarily, or chronic, leading to emotional exhaustion and long term health issues. Anger and stress have a bidirectional relationship. Chronic stress lowers emotional tolerance, while unresolved anger increases physiological stress. Effective stress management includes identifying stressors, behavioral modification, boundary setting, adaptive coping, cognitive restructuring, acceptance strategies, emotional expression, and somatic regulation. In DMT, stress and anger management are approached through embodied processes rather than verbal intervention. The body serves as both a container and communicator of emotional experiences. Chronic stress often manifests as restricted breathing, muscular guarding, or movement inhibition, while anger may present through sharp movements or excessive muscular contraction. Therapeutic interventions such as grounding, breath body integration, rhythmic movement, and expressive improvisation help regulate autonomic activation and restore emotional balance. Movement facilitates catharsis, emotional expression, and nervous system regulation. Group DMT provides social support, co regulation, and relational connection. Neurophysiologically, movement promotes endorphin release, improves circulation, and enhances emotional integration. Therefore, from a DMT perspective, anger is not simply an emotion to suppress, and stress is not just a mental burden. Both are embodied experiences that can be observed, processed, regulated, and transformed through therapeutic movement.